CEO of Alluvian Health, Bill Preston, is keeping a close eye on the potential Medicaid cuts.
The scariest thing is, we realize the impact's going to be substantial.
This comes from a study by the Montana Healthcare Foundation that said that Montana Medicaid funds could be affected by 21 to 25%.
On a percentage basis, we will be the biggest impacted state in the country for Medicaid, of receiving Medicaid funds.
And healthcare coverage could drop in the state.
Actually, by 2028, we believe that probably somewhere around 31,000 is the current projection of Montanans will no longer have health care coverage.
Preston has been preparing since the new year and knows the damage it could wreak on Alluvian.
This bill could set FQs and community health centers back 13 or 14 years, back to 2013.
In Helena, the Montana Hospital Association is also preparing for the bill to pass, but they are feeling slightly more optimistic.
Here in Montana, we think that our state will fare better than a variety of other states, just based on how our state has designed its Medicaid program.
Vice President of Communications for the MHA, Katie Mack, says that Montana Medicaid is doing well spending within its means.
I would say that we are relieved that this bill doesn't seem to present any immediate impacts to our state Montana Medicaid program and to many of the rural healthcare providers that depend on it. However, there are a lot of the devil's in the details.
Those details are unknown, but may include making it more difficult for Montanans to sign up for Medicaid. The MHA says they will continue fighting for Montanans to receive the coverage they deserve.
We are continuing to advocate for the implementation in a way that doesn't kick off deserving and qualified Montanans from their care.
And they are happy to see the rollbacks on staffing requirements in the bill.
These staffing requirements would have been impossible for Montana's nursing homes to meet because we simply don't have the workforce.
As of now, it's a waiting game to see just how Montanans will be affected.
I think it's important to note that if we were to suffer any significant reductions in Medicaid coverage in our state, that would have impacts for all of us.
In Great Falls, I'm Tommy Lynch, MTN News.